Hey everybody, it's Ron. Hey, it's Friday. Happy Friday to everybody. I made a video on the way out here to my oncology appointment for chemo, and I started thinking about how I felt in that video, and I don't know. Yeah, I'm probably not going to show that one. Um, so I'll tell you what happened at my chemo oncologist appointment with Dr. Rasmussen. Nice guy, just getting over a cold, kept his mask on, no big deal. Um, Filled out some paperwork. They got my weight and stuff, stats, blood pressure, and all that kind of stuff. I've lost 3 pounds since Tuesday, so yay. Uh, I'm not trying to lose weight. it's just sort of coming off a little bit here and there, but that's okay. Maybe if I'd had that peanut butter and banana smoothie after my egg bites today, that would have been a different story. But what do you do? All right, so some news. He wanted to find out. He wanted, from my perspective, do I understand what's going on, and what do I understand about the treatments? And by the time I finished, he goes, well, you have about as much knowledge as anybody can have about this. You're absolutely right, and from an educational standpoint, I'll try to fill in some gaps. But yeah, he doesn't think I'm going to need a port. Most of his patients don't, which is great. He says if we have problems getting to your veins, well, or if you wanted one, we could. The idea that these are going to be just 3 treatments, first week, third week, fifth week, no, every week. Every week for at least 5 weeks, because it's in tandem. Now I understand that better. It's in tandem with the radiology treatments that I'll be having in Thousand Oaks. So it's just once a week. 30-minute session, but I'll be there over an hour and a half because I have to do blood work every week that I'm there to see where I'm at. My biggest goal will be to stay hydrated, very hydrated each time. And because they're a week apart, that gives me time to recover, and it gives the chemo radiation combination, what's needed for it to do its job. So again, I think all the treatment will start on February 3rd. Again, if different results come back from my PET scan, which will be on Monday, this coming Monday, that could change a lot of things, but I don't think it will. I think that's just going to show what's up here, and hopefully I'll be okay. Last week's been a little tough mentally. I've been very angry, frustrated, and treatment hasn't even started. I feel like a whiny little baby complaining because the hard part hasn't started. This is the easy part. Swallowing certain foods, yeah, it's not real fun. Throat burns after food, that seems to be getting worse. And after the doctor on Tuesday massaged my neck looking for the nodes, my neck's been really sore after that. It feels, again, a little bit better today, but I don't want people to be messing with my neck, or if I accidentally brush it, it hurts. It definitely hurts, but I'll get over that. This doctor agrees with the ENT, who agrees with Dr. Abelson. They all say the same thing. About week 3, my life's going to change, and it's going to be brutal. And then at the end of the treatment, it's going to be pretty brutal. So I'm just going to enjoy this comfortable pain. And I guess the best way to put it mentally is I'm sort of somewhat comfortably numb. There are resources, if I need them, that, they'll call out and say, hey, how are you feeling today? Do you feel like jumping off a ledge? No, I don't. And ruin this fine jacket? Of course not. But, those things are available. Having a support system is absolutely paramount. And I've been leaning a lot on Roger DeBalt, a friend of mine, who's gone through what I call real cancer. I still refer to mine as the paper cut version of cancer. And here's some other news you may not know. If you look up where I'm at in my process of cancer, because it's metastasized and it's in the nodes, typically that's considered uh, stage 3 cancer. And so that's like one stage less than the shit that will just kill you, right? And so you start thinking about that, and you're like, wow, that's no bueno. But in talking to Dr. Rasmussen, he says that that's changing. It has already started to change because of the HPV variant attached to this cancer, and because it's very treatable and it's a favorable outcome, that this is more considered a stage 2 preventable, which I don't know. It certainly sounded good to hear that. If I'm able to jump down a stage, that's nice. And I think the placebo effect alone from that makes me feel better. So that's a good thing. So if anybody sees this and you're going through this, do not assume that you're at a specific stage until a professional tells you, yeah, you at stage 4, you at stage 3, you are at stage 2, whatever it is. Don't get in your head with that, because that number doesn't really mean anything depending on the type of cancer you have. All right, I'm feeling better right now about this, so I'm thinking I'm going to stop and drive through and get myself a peanut butter banana smoothie and go home, and then I'll have dinner later. But yeah, positive. I know for those of you that have been hanging out with me in my Zoom room, my weekly call, I know last night I probably went off the hinges when there were only about 8 of us left. Sorry. I just got really frustrated from other things, and I would just sort of just, yeah. I basically wanted to take every monitor in my office and throw it out the window. That's kind of how angry I was getting last night, and I just had to put my head down and just breathe and calm myself down. I think that's going to happen, but I don't need anybody else. I don't need to pull other people. I don't need to be a burden upon other people. At the same time, this is very, very important for people that have issues like this. If somebody offers help, you take it. If somebody's willing to listen, you let them. If they've gone through this and they already have experience, try not to feel like you're a burden, because they've already been there and they're going to help you. Just listening, they're going to help you. And just trust in that friendship. That's it. All right. Let's go have ourselves a nice smoothie and finish a great day. We'll see you.